everyone. I am Dr. George Manayath from Aravind Eye Hospital, Coimbatore. During this Macular Week awareness program, it is important for us to understand that most of the vision loss in retinal diseases happen due to the macular involvement. Macula is the center point of retina, the nerve of the eye. In people above 60 years of age, the common disease that causes vision loss in retinal disease is age-related macular degeneration. During the early stage, that is a dry stage, specific vitamin supplementation is sufficient, but in late stages of age-related macular degeneration, they require intravitreal anti-VEGF injections to maintain the vision and prevent severe vision loss. In diabetic patients, which is so common in India, around 15 to 20% have the retina affected, which we call as retinopathy. And the most common cause for defective vision in diabetic retinopathy is macular edema, which needs injections, intravitreal injections to maintain and improve vision. And in hypertensive patients, uncontrolled hypertension usually results in retinal vein blocks or occlusion, which again causes macular edema and vision loss. This again requires intravitreal injections as therapy. In young patients who are 40 years or 30 years, the most common disease, macular disease causing central vision problems is central serous retinopathy, which also can be treated, and with laser therapy they gain vision and improvement in the central scotoma. Even in young children, they can be affected by macular diseases like the inherited macular dystrophies. So it is important for us to understand these macular diseases, which is common in the general population, which causes defective vision, and seek early treatment for better prognosis. Thank you.